Hello, so today we'll be understanding the triple CT scan of the liver. So it seems very complicated at first. Why is it done only in the liver? What do you mean by triple CT scan? Okay, so let's just start from the very basic and let's make this explanation very intuitive. Okay, so let's start with the basic blood supply. So a normal organ has a very simple blood supply, right? The artery gets the blood in, the vein gets the blood out, done. But the liver is very different. It is supplied by two sources, the portal vein and the hepatic artery. So most of the blood that the liver gets is from the portal vein, and the nature of the blood flow is slow, gradual, and it entirely fills up the liver. Okay, but the blood that comes from the hepatic artery, since it's an artery, the flow of the blood is rapid. So the blood comes in rapidly, it goes out rapidly. Okay. So now after you've understood the basic blood supply of the liver, let's understand what the triple CT scan of the liver does. Okay, so basically we inject a dye intravenously and we take 3 photographs of the liver at different times after injecting the dye. So the first photograph, which is the earliest, is the arterial phase. It is taken just after injection. So lesions with lots of arteries will light up here. Okay. The second photo that we take, the middle photo, is the portal venous phase. It's taken a little later, and in this, the normal liver brightens up. Okay, right? Remember I told you the portal vein has slow, gradual blood supply. So it'll lighten a little later than the arterial phase. Normal liver will completely brighten up since it's the majority blood supply, remember? But some tumors with decreased portal supply will lose the dye here. Here it's very important, okay? And in this phase, they will appear dull as compared to the normal liver, which is brightening up in this phase, okay? Then the third photo that we take is the delayed phase. So dye has completely washed out, but some lesions will hold the dye. And on the basis of these 3 phases, we can differentiate lesions depending on their blood supply and the characteristics of that blood supply. So to make this explanation even more intuitive, I'll first tell you the characteristics of blood supply of the lesion, and then I will tell you how it will look on the triple phase CT scan. Okay, this will help you in predicting how any lesion will look on the triple phase CT scan if you know its blood supply and the nature of its blood supply. Okay, so firstly let's start with HCC. So in the normal liver gets most of the blood from the portal vein, right? So it holds its contrast for a longer time. But what happens in a HCC? It loses its portal supply. This is very important, okay? And it develops new abnormal arteries. So blood will rush in fast and it'll rush out fast because of the new arteries, right? Vascularization of a tumor. So how will it look on a triple CT scan? Let's see. So in the arterial phase, it will look brighter than the normal liver, right? Because it has more arteries than the normal liver. It has more abnormal arteries rather. In the second image, in the portal phase, the normal liver is filling up, right, with the portal blood. But since portal blood supply of the HCC is reduced, it will appear less bright than the normal liver. Okay? And in the delayed phase, it will appear completely dark. Okay, this is known as the complete washout. It's also known as the early washout of HCC, very characteristic finding. And this is because there is less portal blood supply in the HCC, right? So while the normal liver has lost most of its dye, it will still appear a little bright. But HCC, no portal blood supply at all. So completely dark. So yes, that's it. I hope you understood this well. I'll also include a table which has all the lesions and their findings on a triple CT scan of a liver, and then you can intuitively understand the blood supply and the nature of the blood supply of each of these lesions. So you won't have to rote learn any of the findings once you know the character of the lesion. Okay, thank you.